Today's session is completely E&M outpatient session. Okay, whatever we are discussing today, that is completely related to E&M outpatient only. Okay, that is completely related to E&M outpatient only. Okay. Yeah, okay, guys. This is a other than E&M services. This is a other than E&M services. Actually, we have discussed it, right? If you are going with E&M OP, we have to prepare MDM. Okay, we have to prepare MDM. Then we have to prepare other than other than E&M services. Other than E&M services. Today's session is other than E&M services. Means except this MDM we have to use some other guidelines for some type of charts. Okay, then we'll discuss one by one what those charts and how we have to code that one. Okay, yeah, okay, guys. Then, guys, first one is better. I am sharing my
Vijay, I'm
screen.
not able to see your screen.
Yeah, I am sharing now. Now, guys, are you seeing my screen? Yeah, could you guys please confirm?
No, Vijay.
I'm sharing. Now, see.
It's
Yeah, actually, I have started the sharing, but I didn't open. Now it's showing right for everyone. It is visible, right?
Yes.
Yes,
Yeah,
Vijay.
okay, guys. Then, guys, first topic is preventive visits or annual wellness visits. Guys, this is some of guys, whatever we are discussing today, that is 100% interview questions, guys. Whatever topic we are discussing today, that is 100% interview questions. Okay, then that's why very easy only, guys. We will discuss multiple topics, everything easy only. Okay, then first we'll go with annual wellness visits. Guys, what is the meaning of annual wellness visits or preventive visits? Means patient will come for screenings, guys. Like every year, insurance company will provide a particular wellness visit. Means in our office also they will provide some wellness visit. Means physician will check like to stop to identify any possible diagnosis like patient mother have a diabetes, patient coming for a annual wellness visit means patient have option to identify if anything DM started or any possibilities to check the screenings, counselings to prevent the illness. Okay, annual wellness visit means to prevent the illness. That's why physician will perform screenings and counselings. Okay. Yeah. Then coming with annual wellness visit chart, how to find whether you are coding a annual wellness visit chart or normal E&M chart means in HPI, patient will state like patient present with uh, complete physical examination or health me visit, health me visit or um, annual wellness visit. Okay, they will mention like this patient came for a wellness visit, patient came for an annual wellness visit, a health wellness visit, a health me visit, or complete physical examination. Okay, then after seeing that HPI, okay, this is a wellness visit. This is not a office visit. Office visit means outpatient visit. Okay, then you have to use annual wellness visit guidelines. Okay, first step you have to check the HPI whether patient came for a annual wellness visit or office visit. Then next you have to check the insurance. How many types of insurances we have means first one is commercial insurances, next one is Medicare insurance. Medicare or Medicare only, Medicare insurances and commercial insurances. We have total two types of insurances, guys. Okay. Then second, you have to check the insurance, whether that is commercial insurance or Medicare insurance. Suppose if that is a commercial insurance means you have to follow preventive visit guidelines. If suppose that is Medicare insurance means you have to follow annual wellness visit guidelines. See the difference, guys. Preventive visit motive is same, but some guidelines and wellness visit. Okay. If commercial insurance means we have to follow preventive visit. If Medicare insurance means we have to follow wellness visit. Okay. Then what is the criteria we have to check for Medicare insurance? What is the criteria we have to check for commercial insurance? Here we have to discuss. Then coming with first point, what is the suppose that is a Medicare insurance means you have to follow annual wellness visit guidelines. What is the main criteria to check the annual wellness visit means? First one is HRA, guys. HRA means health risk assessment. Health risk assessments, guys. Okay. What is health risk assessments means? Like physician will perform the physician will check like risk assessments, like screenings, guys. This chart completely look like a physician will perform all screening like a PHQ screening, GAD screening, uh, fall screening, and physician will check every screenings. Okay. Health risk assessments means what is the any possibility of that particular condition. Okay. And they will order screenings like colonoscopy screening, ultrasound breast screening, and they will order multiple screenings. Okay. Means what is the main criteria we have to check? Health risk assessments, remaining HPI, patient conditions, patient medications, patient previous surgeries. That is common. Along with that, we have to check the risk assessments. Okay, we have to check the risk assessments. Means that is entire screenings we have to check. Screenings. Physician will perform the screenings like how was your vision, how was your hearing, how was your colon. They will check everything to prevent like any possibilities or anything started. Okay, that is the main criteria. Then second one is you have to check the patient's providers list. What is the providers list, guys? Suppose the patient have a diabetes, taking management with so and so physician. Patient have a neuro conditions. Patient continuing with so and so physician. For neuro, he is consulting with so and so. For DM, he is consulting so and so. For ortho, he is consulting so and so. Means the patient have a some patient care team. Okay, we have to check the patient providers list. Any one is enough, guys. Any one provider list. They will mention like a patient provider list, and they downside they will mention the patient neuro so and so physician, ortho so and so physician. Like that, we need any one physician name for a providers list. Next one is future scheduled screenings. Future scheduled screenings means future scheduled screenings means here everything performed, remaining next to colonoscopy future 2027, ultrasound 2026. This is future means future. Physician need to order any one future scheduled screenings. This is the main criteria, guys. You have to check this documentation for Medicare insurance. Is it clear?
Yes, Vijay.
Yeah, then coming with codes, guys. Coming with codes. G0402 first code. Coming with codes. Coming with G0402. This is welcome to Medicare. G0438. This is initial visit. G0439. This is subsequent visit. Guys, first code is G0402. Patient in a first time in Medicare means previously patient in some another insurance. Today patient are recently patient converted to Medicare. Then patient came for first time in Medicare insurance. In that time, physician will perform. In that time, physician will perform G0402. That is welcome to Medicare visit or IPPE visit. What is IPPE? I have shared in WhatsApp. Initial preventive physical examination. Okay. First year physician will perform IPPE visit. Okay. Then when again patient when will come to annual wellness visit again? When patient will come, guys? Patient completed G0402. Then again patient when he will come to hospital? After 1 year, again patient will come for annual wellness visit. We then second time we have to code G0438, that is initial visit. And coming with every third year, fourth year, fifth year, every year we have to code G0439 regularly. Okay, for every year. First year G0402, second year G0438, and third year onwards you have to code. We have to code G0439. This is the Medicare visit. Suppose your chart not qualifying with annual wellness visit, means in your chart no HRA, no screenings, no providers list, means you can consider as a ENM outpatient office visit and code normal ENM codes. Clear, guys? Clear? Annual wellness visit?
Sir, from
Yeah.
above, sir, from above this criteria, at least one should match or
No, everything.
everything should be there.
Everything. Three, that is
Okay.
three very important. Okay. If not qualifying, then you can go with normal ENM visit. Guys, minimum duration for annual wellness visit. Suppose today patient came for annual wellness visit, means next again we have to code within 11 months duration. We have to check, but these things and all, it's completely based on your client, guys. Okay, minimum we have to check the 11 months gap. Okay. Then coming with commercial insurance, very easy, guys. If suppose patient in a commercial insurance, means what is the criteria, means you need a complete physical examination. Okay, in your chart, you have to check the physical examination, whether physical examination is there or not. As per general guideline, complete physical examination means 8 PE systems we need. But most of the clients, they will not follow this thing. If complete physical examination in your chart, physical examination is there, means then they will follow preventive visit, guys. Okay, they will follow preventive visit chart. Then what is the codes, means here very easy, guys, completely based on age. Suppose the new patient means 993812 Total 7 codes based on age. Like every code have a some specific age range. If you want, you can check in Google or you can check in any AAPC or Encoder Pro. Like 99381 less than 1 year, 99382 2 to 4 years, like that. Every code have a some specific age range. You can check the age, patient's age, and you can code directly. If suppose that is established patient chart, means 993912 99397. Total 7 codes based on age. Prevent visit very easy, but annual wellness visit we have to check the HR. This is the annual wellness visits and preventive visits, guys. Then you know, right? What is the ICD code we have to as an Ju code Z0000. If patient depends upon age also, for well woman exam, we will use some other Ju code. For child, we will use some other Ju code. That will be, but generally we will use Z0000 of ICD for this particular annual wellness visits. Clear, guys? Any doubts with annual wellness visit and preventive visit?
Vijay, how to find out whether it is welcome, initial, or subsequent?
You have to find, you have to check previous visits, when patient was insurance enrollment date. You have to check the patient insurance enrollment date. Actually, in appointment list, we have option to check. You have
Sir,
to
a
check the
joint
last
visit.
year visit. Okay. You have to check the previous visit, whether previously what was the documentation, and this year what was the documentation. We have option in software, or in some softwares you have option like what is the last what is the previous year what coder was coded, what was billed, and now patient coming for, then we have multiple options to check. That is only, it depends upon software. But every software we have option to check whether any previous annual wellness was billed or not. Like if patient coming for today annual wellness visit, tomorrow also after 1 week patient coming for annual wellness visit means then we need some proof. We have to check what was the last previous preventive visit. Okay, you can check in appointment list. Okay, patient came 1 month back only. Then today is not a preventive visit. This is a E&M visit. You need minimum time duration. You have to check, guys. Okay, clear?
Sir, I
For
joined little
ENM,
later.
what is the ICD?
Ma'am, please, ma'am, if you are joining late, I don't have option to repeat, right? Please understand my situation also. Okay, everyone, please join at the time, guys. Yeah, bro. Sorry.
For E&M, what is the ICD?
E&M depends upon patient condition. If
Yeah,
patient have
okay.
hypertension, you have to hypertension. Patient have diabetes, you have to go diabetes. Then, okay, guys, suppose patient present with a annual wellness visit or preventive visit. While doing this visit, uh, physician identified any problem. Example, at the time patient feeling headache. For that problem, physician providing a some medication like Tylenol. Then this concept, it will be not included in preventive visit or annual wellness visit. Preventive visit and annual wellness visit, physician need to check only screenings. If patient have any additional problem, then what we have to do for this problem?
We have to give additional ENM code.
Suppose your chart, new patient chart, you have coded 99387. In your chart, physician identified some additional service and treated as a provided a treatment. For this particular concept, you have to code additional E&M services along with 25 modifier. This is 100% interview question. In these cases, what is your ICD means? Z0001 means annual wellness visit with abnormal finding. Okay, this is very important interview question. Leave about ICDs, guys. That is very easy. If patient, when can in interviewer will ask like, can we code preventive visit with E&M means your answer should be yes, we have to code. If patient have any abnormal condition and physician provided a treatment for that problem, in such cases, we have to code preventive visit, we have to code E&M along with 25. They will ask particularly 25 modifier with preventive visit or E&M visit means with E&M only we have to code 25 modifier. This is 100% interview concept. Clear, guys? Coming
Vijay,
to,
can you
yeah,
please repeat this?
simple ma, if physician finded any additional abnormal finding and physician provided a treatment means you have to code additionally and with 25 modifier.
For ICD only Z series.
ICD Z0001 and you have to code any other services also. This is your PDX. Guys, ICDs for
Okay.
newborn, we have separate annual wellness visit code. For well women, means women's also, we have separate ICD code. For adults also, we have separate ICD codes. But whatever, just I am giving example, suppose this is adult code and 0000 Z0000, this is without abnormal finding, Z0001, this is with abnormal finding. Well, women exam also, I don't remember exact code, Z011998 something. And with abnormal finding also, we have separate codes. Every based on age, we have separate ICD code without abnormal finding and with abnormal finding. Leave it ICDs, guys. Actually, I will be focused on only NM services, guys. Okay. Clear concept wise?
Vijay, you told a headache as an example. So we need to code headache also, right?
Yeah, guys, conditions ICD, you have to code everything. Not only this, not only Jew code. If patient have multiple chronic conditions like diabetes, CKD, this is your first preferred diagnosis. You have to code Jew code Z0000 and remaining if patient physician addressed any hypertension, diabetes, CKD, stable, CHF stable, they will mention multiple chronic conditions. You have to code all ICDs first.
Okay, Vijay.
Okay, guys, this is something
What
important. Okay, yeah.
Vijay, if physician find some screenings, like if the patient is having some problem, then what we need code?
You have to code if while doing annual wellness visit or preventive visit, if physician identified any problem, you have to code additional E&M for that service.
Okay.
Annual wellness visit means patient everything fine, patient don't have anything, but patient came for just annual wellness visit. That is annual wellness visit. Suppose if patient have any problems means you have to code annual wellness visit and you have to code that particular problem as a E&M office visit. Clear?
Okay.
Now coming with next services, prolonged services. Guys, prolonged services. What is prolonged services means if physician spent more time, if physician spent more time with a patient, in that cases, we have to use prolonged services. Okay. Everyone, I have shared in WhatsApp. I have shared some PDF in your WhatsApp. Please, everyone, open that PDF. And this is commercial insurances. This is Medicare insurance. Yeah, tell me guys, if patient is a new patient and physician spent 70 minutes of time, what is your E&M code?
Double 9205.
If physician spent 75 minutes of time, then what is the highest code, highest time? What is the maximum time for new patient, ma?
74.
74 minutes. We don't have code for 75 minutes. Then first 74 minutes, you have to code 99205. Remaining 1 minute, you have to hold 99417 if you are doing a commercial insurance chart. If you are doing a commercial insurance chart, you have to code prolonged services code 99417. Suppose physician spent 75 minutes of time, you have a code for 74 minutes only. Then first 74 minutes, you have to code 99205 and remaining 1 minute, you have to code 99417. Suppose if physician spend 90 minutes of time, new patient, then what is the course? Please break up this, guys. First 74 minutes, 99205. And guys, please remember this 99417 maximum time is 15 minutes. Then for first 15 minutes, what we have to code? 99417. Then how much balance we have?
One.
How much? 1 minute. Then again, you can code 99417. For each 15 minutes, you have to add 99417 into one, into two, into three, like that. This is the guideline for commercial insurance. Then the code for commercial insurance is 99417. Clear? Then coming with Medicare insurance, suppose you are doing a Medicare insurance chart, your This is also 15 minutes time. Suppose this is a new patient chart, physician spent 75 minutes time means then 74 minutes. You have to go 99205, then remaining 1 minute not codable. If you want to code a G2212, you need complete 15 minutes. For Medicare, a commercial insurance, we can add with 1 minute also, 2 minutes also. But Medicare insurance, they will not accept. They need complete 15 minutes. Then coding for 90 minutes time, what is the codes we have to code? First 15 minutes,
G double two one two.
Double forward.
remaining 1 minute,
Not codable.
because we need complete 15 minutes, then only we can add double line G2212 into 1 into 2 into 3. This is the guidelines for commercial and Medicare insurance prolonged services. Any doubts with this? Any doubts, guys?
No, sir.
Clear?
Yes, Vijay.
Yeah, then coming with next concept. Next concept. Yeah, next one is next one is what is the next services I have shared, guys? Place of service, guys. Place of service code. This is not a guideline. This is not a coding thing. This is completely billing concept. But we have to remember our department number. What is our department code? Means like what is our place of service code? Like radiology department have some specific code. I don't know HCC have place of service code or not. Like that, for E&M outpatient, the place of service code is 11. For E&M inpatient, the place of service code is 21. For ED, place of service code is 23. For televisits, place of service code is 02. You just remember the number. You just remember the number. Okay. Clear, guys? This is the just number. We will not use in coding. This is just a billing purpose. But as we are doing so and so department means we have to remember that particular department code. That is the reason I have mentioned, because this is some important interview question. Clear?
Yes, Vijay.
Next one is very important, guys. Televisits. I think after lockdown, every hospital was started audio visits, video visits, right? Then, guys, televisits. Actually, we have a some other visits before 2025. Means last December, we have some old guidelines, and after 2025, we have a new guidelines. Just I will give small revision about old guidelines and new guidelines. New guidelines is very easy. It's based on time or it's based on MDM. You have to find table ABC level, then based on your MDM level, you have to code. That is very easy. But what is the previous guideline? But some of the companies also still following old guidelines only, because that company was not updated with new guidelines. This is old guidelines before 2025. Whatever it is, we have some specific 2 points. First point is, guys, if patient present with a televisit, they will mention very clearly like a patient present with a televisit connected with through audio, connected through video. or they will mention very big heading in top of the chart like televisit. Then after seeing that, first step you have to cross check this guideline currently, guys. This guideline currently we have to check. First thing in your chart, you have to check patient location. In chart, we have to check the patient location. Whether patient in a home or patient in a work or anything, you have to check the patient location. Second point is patient acceptancy, means consent form. Means I am accepting the video call visit, I am accepting the audio call visit. Means they will mention one single line statement like patient was accepting this call. And third point is you need a clarification, like you need a proper documentation whether that audio visit or video visit. If patient stating televisit means you will get confusion whether that is audio visit or video visit. You need a proper definition like I connected audio only, I connected video audio. This is the way you need a small clarification. These 3 points as of now, current also you have to check. Current also you have to check these 3 points. Clear? Then coming with previous guidelines, guys, for video visit, uh, normal E&M outpatient with 95 modifier, guys. Okay. E&M outpatient, normal office visit only. If suppose that is a video visit means we have to use table A, B, C, new patient, established patient, as usual E&M outpatient, but we have to append 95 modifier. Suppose it's audio visit means it's completely based on time. We have total 3 codes, 994441, 442, 443. I have already shared in WhatsApp, like what is the time range. That and all no need, guys. That all deleted. This all was deleted. Okay. Video visit, normally end up with 95 modifier. Audio visit, we have a course based on time. This is before 2021. This is before 2021. But after 2021, we have a codes. What is that codes? If audio only mean audio video visit, new patient, 98 0002 98 003. For established patient, same continuation, 990, sorry, 98 0042 98 007. Then again continuation, audio only next, 98 0082 98 010. Again, this is new patient. Again with established patient, 98 0112 98 015. This is the code, guys. Currently, this is the audio video visit. This is audio visit. Based on MDM only. You have to find MDM. Then based on that MDM only, you have to code. Any doubts with audio video visits, televisits? Clear, guys?
Vijay, what you
Yeah.
told about this, na? It is before 2025, right?
This is new guidelines, 2025 onwards.
Uh, which one? Just now you told this audio and video, right?
Yeah, yes. Then this is before 2025. Before.
Okay.
Okay.
Okay. Okay, Vijay.
Clear, guys? Very, very important vaccination coding. Guys, this is vaccination is administration codes. Administration means only administration codes. Product codes different. Product codes means that quantity, like how much ml, how much mg. That product codes it will be changed and company will provide you our HIPIX codes. That is separate sector, guys. Okay. Administration codes only we have to code. If you have an instruction, then you have to code product codes also. Like product codes means how much quantity for this quantity, this vaccine, this is the code. Like company will provide you a some proper list. Now we are discussing only administration codes. Yeah, guys, coming with vaccinations, will differentiate like two categories. First category, less than 18 years with counseling. Less than 18 years with counseling. 90460 and 90461. Then coming with next category, what is the quite opposite, guys? Less than 18 years without counseling. Then greater than 18 years with or without counseling. See, guys, less than 18 years with counseling, less than 18 years without counseling, and greater than 18 years with or without counseling. These three have same guidelines. This one have some different guidelines. Yeah, these two codes for IV or IM vaccination. These two codes for oral or nasal. We have total four codes. 90471, 472, 473, 474. Guys, here first thing, if patient received IV vaccines means for first vaccine 90471, remaining how many different vaccines also? 90472 into 1 into 2 into 3 like that we have the code. Suppose patient received a 3 IM vaccines. Then what is the codes, guys? 90471, comma 90472 into 2. Total 3 vaccinations. Same like oral or nasal also. Suppose patient received a 5 oral vaccines. Then 90473, comma 90474 into 4
4.
times. This is the way we have to code, guys. Very easy only. Then here my question is 2 IM vaccines and 2 oral vaccines. Then what is the codes for these 4 vaccines? 90471,
471.
472
Comma
90472, 9047,
3
2.
9047.
and
First two
4.
IM vaccines, 90471 and 90472. Remaining 2 oral vaccines, 90473 and 90474. But here we have a one update. If you are coding a 71, don't code 73. Then what we have to do?
474 into 2.
Exactly. You have to replace with 90474. Clear?
So we can't code two primary codes at the same time, right?
Yes. Clear, guys? Then coming with less than 18 years with counseling. With counseling means physician will take counseling. Like this is the uses so you have to take. This is the possibilities to prevent this so and so. They will mention like with counseling. I have taken some counseling. This and that. Guys, this with the counseling codes, you have to code based on products. Sorry, sorry, guys. Based on components. Okay, you have to code based on components. Guys, every vaccine have a some components. Guys, that company will provide you like what is the vaccine, what is the components, and what is the product codes also. They will mention. There is no issue about that. I will show you like how that was. This is the vaccination list. I think it will be update regularly, guys. See, this is the vaccinations, guys. Like every vaccination, uh, we have a some product code. We have a some product code, and every vaccination have some component. Like for this vaccination, this is the component. This is the vaccination. This is the components. Like every vaccine code have a some specific component. Just give me 1 minute, guys. I will be back again. Yeah. Okay. Uh, every vaccine have a some product code and components list. Then for this coding, we have to code based on component. We'll take one example. Suppose Tdap vaccine have a three components. Sorry, DTaP vaccine have a suppose five components. Then based on these components, you have to code. Suppose this patient have received these two vaccines. Tdap three components, DTaP five components. Then how we have to code means code based on components. First three components. First TDAP. First go by one. TDAP means 90460 comma 90461 into
Two.
Two.
then 90460 comma 90461 into
Four.
Four.
4.
then combine three. 90460 into 2, 90461 into 6. This is your final output for this particular vaccines. This is the way you have to code the vaccination with counseling. Without these questions, interview will not happen for E&M. Annual wellness visits, preventive visits, prolonged services, the vaccinations, this and all very important, guys. Interview point of view, but daily you will not get that much of charts. Mostly you will get one or two charts. Clear with counseling and without counseling.
Vijay, can you please share that vaccine list in that group?
No, no use actually. That is old one. Every company will provide you. Like for references, I will share you, but don't follow that. Every year, that simple logic. Vaccine have suppose COVID, new company was started new vaccine. Suppose then they will create one number for that vaccine. Like everything, it will be every year it will be update. Okay, but
Okay,
for
but
reference, I will share
not
that
just
vaccine.
for. Yeah, okay.
Okay, guys, clear
Vijay,
vaccinations. Yeah,
You have given one example for 2 IM and 2 oral, right?
Mm.
For that, what can you please repeat that one?
Simple. First two IM codes means 90471 472. Two oral
Okay,
means 473 474. But here, if you are coding
correct.
74, don't code 73.
Hmm.
If you are coding 71, don't code 73. Replace with 74.
Okay,
Simple.
okay,
73 you can replace
hmm,
with 74. That's
okay.
clear, guys. Then last topic, guys, transitional care management. This is not that much of important, but remember, guys, transitional care management or hospital discharge follow-up. What is the meaning of hospital discharge follow-up? Suppose patient admitted for 1 month for so and so reason. After, obviously patient will discharge, right? After some time. Then after discharge, patient will come for follow-up. That is hospital discharge follow-up. Okay. Patient will come for after admit. Means how was patient's health, how medications going on. Just in regularly we will, if patient, suppose if we admitted for so and so reason for hospital, means after discharge, obviously we will prefer to go one more time, right? That is TCM, transitional care management. Then if you want patient, very mentioned very clearly, they will mention patient present with a hospital discharge follow-up or patient present with a TCM. After seeing that sentence, you have to check the TCM guidelines. Then what is that guidelines means? In your documentation, patient need to mention the discharge date. When was patient was discharged? Mostly they will mention. In HPI, they will mention like, my name is so and so. I have admitted on so and so date, and I was discharged on so and so date. They will mention for sepsis for 5 days. The HPA, this is the story, 99%. Okay, here discharge date is there. Okay, you have to check the patient discharge date. Second point is communication within 2 days. Means after discharge, patient was discharged on 5th, right? 6th and 7th, within the 2 days, patient or any patient's family members or anyone need to communicate with hospital. We are coming on so and so date. We are coming after 5 days for hospital discharge follow-up. Means communication need to mention. That is also, it will be available mostly like, they will mention like, communication through video call or through audio call, communicated on 6th, so and so time, 5 p.m. Like that they will mention. Means communication within 2 days only. Then third point is minimum, you have to check MDM, guys. You have to apply table A, B, C, and you have to find MDM. Minimum MDM level should be moderate. If your MDM going to low, then code normal office visit. If your chart not qualifying with any 1 point also, you can go with normal EM. If 3 points qualifying, then only you can go with TCM. These three guidelines clear. Hmm?
Yes, sir.
If patient
Vijay,
coming with
can
the
you
Yes.
report
repeat it once
numbers
again?
means, yeah. If patient, yeah. First thing you have to check in your documentation like patient discharge date. You need a evidence of discharge date, guys. When whatever, when wherever in your chart, you need a discharge date. Then you need a communication within 2 days. Okay, patient discharged on so and so date. After within 2 days, need communication. Whether patient was consulted with the hospital or not, communicated with hospital or not. Then minimum MDM level should be moderate. Means your MDM must be supported with minimum moderate or high. If low, supporting with low means then don't code TCM, code normal ENM code. Missing communication, code normal ENM. Missing discharge rate, code normal ENM. If three is there means use this two code. Patient coming within 14 days, this is the code. Patient coming within 7 days, this is the code. This is the transitional care management, but this is not that much of important. But we'll get daily, weekly once chart or two charts, we'll get PCM charts. Clear, guys? Clear? Any doubts?